Good afternoon. Welcome to today's Wisconsin Health News virtual event on what's next for medical marijuana in the state. My name is Tim Stum. I'm the editor of Wisconsin Health News. Thanks to all of you for tuning in. We have a really great panel with us today to talk about this pressing topic. Our panel is a little smaller than we had initially hoped. Dr. Angela Janis was unfortunately too sick this morning to participate. We hope she gets better soon. We were just informed a couple minutes ago that Senator Felstowski is no longer going to be able to join us. So we do apologize for that. The good news is we still have a wonderful group of panel with us today to talk about this really important and pressing topic. I am thrilled today to introduce Dr. David Galbis-Reig, past president of the Wisconsin Society of Addiction Medicine. He's also speaking on behalf of the Wisconsin Medical Society today. Representative Darrin Madison and Representative Patrick Snyder. Thank you all for sharing some of your valuable time with us today. Before we get started, I want to make sure we thank our generous sponsors of the Wisconsin Health News virtual series. These important discussions would not be possible without their support. So a huge thank you to Aurora Healthcare, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Gunderson and Bellin Health System, Hush Blackwell, Quartz, and the Alliance. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial, which you can do on our website at wisconsinhealthnews.com. And I want to give an extra thanks today to Hush Blackwell, today's featured sponsor. We are very grateful for all of their very generous and continued support. Here to say a few words is Hush Blackwell partner Hillary Bricken.
Thanks, Tim. And I just want to reiterate how important of a resource Wisconsin Health News is to providers, patients, consumers. And we're so grateful to have this sponsorship and to help continue these valuable series with such good information. I will say I have been practicing for 14 years. I'm licensed in California, Washington, Florida, and now Wisconsin. Almost 100% of that has been in the cannabis industry between adult use and medical. I practiced in all of those states with the exception of Wisconsin. And I can say with great confidence, no state has hit its stride. There is absolutely no gold standard for how to do this or how to regulate it. And that's coupled with the fact that the federal government still considers it a dangerous Schedule I controlled substance. So the wisdom of legalization between medical, adult use, who knows, certainly, in my opinion, should be up to the states at this point, given that they know probably what's best for the health and wellness of their constituents. So to see Wisconsin progress in this field, to me, is very interesting. And I know that some people see it as major progress and other people think it's a Pandora's box. And the truth is, with my experience, it is probably both. So I'm very glad that I get to speak today, give some opening remarks, and I'm certainly going to listen to the panel.
Excellent. Well, Hillary, thank you so much. Some great words to get us started off on. And thanks again to Hush Blackwell for your continued and generous support. It makes these important discussions, truly makes them possible. So thank you again. Thanks again to our panelists for taking some time out of their day to be with us today. As states across the country are loosening their laws on marijuana, momentum is growing in Wisconsin to legalize the drug for medical purposes. Assembly Republicans unveiled legislation this month that would allow residents with chronic diseases to access the drug from state-run dispensaries. But Senate Republicans have been less receptive to the concept, and Democrats are pushing for full legalization. Meanwhile, the state's doctors say there hasn't been enough research on its efficacy. So while this latest bill may or may not make it to the finish line, it could progress further than any other bill of its kind in the state, and it's likely a topic that is not going to go away as Wisconsin neighbors continue to move forward on medical and recreational marijuana, as do almost the majority of the states in the country. I'm assuming this is a topic that will continue to be debated at the Capitol in Madison, as well as at doctors' offices and homes across the state. So we're hoping today to gain some more clarity on where the sides are on this topic, and glean a better understanding of what could be next for medical marijuana in Wisconsin. So Representative Snyder, let's start with you. Thanks again for being here. Earlier this month, Assembly Republicans unveiled legislation that would legalize medical marijuana in Wisconsin. Speaker Robin Vos says it has the votes to get through the chamber, which would be a big step for medical marijuana for Wisconsin. I guess first off, what's changed in your caucus? Why is this something that now has broader support than it used to?
Well, I think thanks again, Tim, for having me on the panel. This goes back to my first session in 2017 when Representative Krug at the time brought forward the bill on CBD oil, especially for young kids that were having seizures and things. And we saw the benefits of that. And so then Representative Mary Felskowski came to me and asked would I be part of a bill to address the medical use of the marijuana plant for some of the more chronic type of situations. And it was kind of amazing because at the doors in my Wausau metro area, I met 3 veterans of the Iraq war that were suffering from PTSD. And one gentleman couldn't even come out on his porch and advocated for this. Senator Felskowski also has a very good story to tell as a cancer survivor. Representative Mako, who is on this, his wife, who passed away a few years ago from cancer, had trouble getting some of the things just to allow her to be able to eat, have an appetite, and so it was just something that I had enough interest in it that it's more for relief than anything else. And so we started back in the summer, working with the speaker and trying to get something put together. And it's a long one, but we had a lot of groups we had to try to compromise with. And that included the law enforcement people, along with many others. And that's why we kind of structured the bill the way we did, with the state-run dispensaries, trying to make sure that it would allow law enforcement to maybe stay neutral on the whole situation and move it forward. And I know that the Senate didn't quite see the same thing when it came to those dispensaries. And I don't know if they have enough people in their Senate to be able to get the bill even introduced. So we did have the votes. We do have the votes to be able to move it through, and we'll see how it proceeds.
So thank you, Representative Snyder. As you mentioned, this is a big bill with a lot in there, as it sounds like you worked with a lot of groups on this. Could you just kind of briefly outline some of the main points of the legislation?
Well, this legislation, we have, first and foremost, we would have a medical marijuana board, and it would be, the chair would be appointed by the governor. It would be under the Department of Health Services. And then DATCAP would get involved when it comes to the growers, the processors, the labs. And in order to kind of appease some of the law enforcement's concerns, that's why we brought up the state-run dispensaries. Now, it's something that's brand new when it comes to marijuana. It hasn't been done elsewhere in the country, and we'd have to see what would happen moving forward on that. But for example, the state of Pennsylvania, they have state-run liquor stores. And it used to be, I know our neighbors in Iowa used to have state-run liquor stores as well. And I know there's some concern about government running anything, but this would be one way of trying to control things on that front. So that was one of the areas. And then we took a lot of the other states' medical marijuana legislation and tried to incorporate it in our own, including some of the ailments that would fall under that. And not only that, but then we'd also be able to, if the doctors didn't want to come out and prescribe the medical marijuana, which is fine, I can understand that. So all they would do, if somebody, let's say, was suffering from the Parkinson's disease, which we added, they would go and their physician, who they normally see and have a relationship with, would confirm, yes, you have Parkinson's disease. So with that confirmation, they would go to the medical board and say, this is what I have. And they would be issued a medical marijuana card, and that would allow him or her to be able to go to the 5 dispensaries around the state and be able to purchase a 30-day supply. And then after that, probably would increase to 90 days. We would have state pharmacists, so it'll be state employed pharmacists at these dispensaries, and they would be able to see other medications these patients are on and what dosage that should come from that for their needs, whatever their chronic illness is. And so it take away from the pressure of doctors actually coming out saying, I'm prescribing this, to more just confirming the ailment they have to qualify for this. We would also let the person have up to 3 what we call person's caregivers to be able to get this and transport it for them. And we have rules on that too. It can't be opened or anything to that nature. They have to bring it right to the person. And that would, similar to like if you have your spouse and you go to the pharmacy to get your prescription, you can pick up your wife's as well as being a spouse. So similar to something like that, because there are people that'll be in nursing homes or hospice that might need someone to be a caregiver from that facility to go get the medication. So those are some of the things that we included in this. And we went back and forth all summer long. We had Leg Council, we had the Legislative Reference Bureau. We brought folks in from Illinois and Minnesota on the pros and cons of everything, and really feel like this is one of the most extensive pushes for this type of legislation.
Well, thank you, Representative Snyder. So as you mentioned, there's a lot to this. I just want to talk about a couple of the points, a couple follow-up questions. So as you mentioned, a main sticking point does appear to be this idea of state-run dispensaries. As you mentioned, Wisconsin would be the only state in the country to do this. Can you talk just a little bit more about how that would work? You said that was in response to concerns from law enforcement. Why would a state-run dispensary, help appease their concerns? Why do they want to go that route?
Right. Law enforcement wants, they're worried that this will not only lead to recreational use down the road, but also would lead to possible abuse by private dispensaries. And a good example of that is what's happening right now in Minnesota. As I don't know if you've read, there was an article in the Min Post back on January 5th that there was a loophole to a flower bud. And this flower bud has excessive THC, more than the state regulation for recreational. But since there's no clarification to this, the state's not enforcing this at this time. So that was the one possible way that law enforcement was worried about abuse, with loopholes with private contractors or private dispensary. And so in order to maybe try to control a little bit more, we have the state dispensaries that would be more regulated by the state and under state guidelines. So those are some of the concerns, but again, everything's negotiable. I just want to help the people that are out there. And if we had a bill coming out of the Senate that had private dispensaries, and we could get law enforcement on board with some of the issues they are concerned with, and that's one thing about the body, we have to try to find compromise. We have to get both sides on board, because if we don't have both sides on board, then the governor's not going to sign it. And he's been open to signing something like this to get it out there. And so that's why I thought maybe this time might be a good possibility of getting something through. But that was the main thing, is that loophole you see in Minnesota with the recreational side of things and the high THC, that some of the things that we wanted to avoid, and that's why we chose the state-run dispensaries.
Thank you. So under this bill too, as you kind of talked about, there'd be 15 medical conditions that would qualify for the program, including cancer, HIV/AIDS, glaucoma. Can you talk a little bit about how those were determined? I mean, did you consult with medical professionals on that? I mean, how did you come up with that list?
For the most part, and we did talk to some medical people as well. The gentleman from Minnesota that was advocate for the medical marijuana was a doctor, and also had the private dispensaries to go with it. But his input, as well as what other states included, Pennsylvania and some of the others that seem to have a successful medical marijuana legislation in place, we tried to mirror that rather than create more than needed. And down the road, there's still an ability, if we don't have something that suddenly pops up that is something that would qualify for this, doesn't mean we can't actually add it to it later.
Great. And then another key point, and I promise I'll move on to our other panelists and stop bugging you. But another key point of this bill is the prohibition of raw cannabis flower. So basically that you can't smoke it. Can you talk a little bit about why that was included in the legislation?
Sure. And it was a concern because a lot of the PTSD and the chronic pain cancer people say that inhaling the smoke or getting into their lungs, it works faster. So that's why the bill goes to the nebulizer, something that they can actually inhale and get to their lungs faster. And the reason being is that concerns about if you were in an apartment building and the smoke and the things from that would go to other neighbors, that might be something they wouldn't care for. And also secondhand smoke with kids around in the house and things to that nature. So that kind of takes that qualification away, but still allows the main purpose of why they wanted something to be able to get into their lungs quicker. And that's why the nebulizer was added to the bill.
Very great. Thank you, Representative Snyder. We will come back to you, but I want to move on to Representative Madison. Representative Madison, thank you for being here, for doing this. I guess first off, what do you think? What do you think of this bill from Assembly Republicans?
Yeah, absolutely. I think there are a lot of really good things in this bill that I really like. And then there are some hard lines for me. Some of the really good things that I like, which the Senate Republicans didn't like, is I do like state-run dispensaries. I'm a democratic socialist, so that kind of works in my favor. But I definitely understand that it's important, though, when thinking about that framework, that we include an equity framework at every aspect of this bill, right? Especially as we think about the historical context of the criminalization of Black and Brown communities as it relates to specifically this drug or this substance. But on some of the other good things, I think the 80% of board ownership or board members have to be residents of the state of Wisconsin was a huge, important piece. It ensures that businesses outside of Wisconsin can't buy into the industry here without being residents here. I think that the piece as it relates to parents' consent for young people under the age of 18 to be able to access the care that they need was really amazing. And I think overarchingly, the fact that the potential of medical use of cannabis happening and being pushed by my colleagues on the other side is a great thing. I think some of my hard lines, they'll come back to some of the pieces that reflect on the historical context of this issue. There are some hard limits on folks being able to access their, access being a producer, being a tester, being a processor. If you have have a criminal background, and you've overcome that, right? If in the past 10 years you can't access this, and access being a producer, a processor, a tester, if if you're still on probation, parole, or so on. I think that's something that needs to be addressed in this bill. And then there's some issues related to employment, and discrimination in employment in this bill. And then as I was looking at the bill and I heard Representative Snyder speak a lot about PTSD, which I think is amazing, I did not see PTSD listed in this bill. And I've looked over it a few different times, but if that's something that he's adamant on pushing, I hope that's included in the mix. But I know that overarchingly, as we think about, ensuring folks that have access to the care that they need, we don't necessarily have to think about or qualify who gets access and who doesn't if we think about both medical legalization and recreational legalization, which is, what I've been pushing, but I know everybody's not there yet.
Thank you. And I guess just expound on that a little bit. As you mentioned, you've been part of spearheading legislation that will legalize recreation and medical use in the state. Why do you think that is a better route? And would you be supportive of something that just went the medical route for now?
Yeah. So first off, I'll go back to that last question, right? Yes, I would be supportive of an only medical bill right now if that's where folks are, but those hard red lines have to be addressed. I've worked tremendously in this, in our legislative body as it relates to fighting for the needs of incarcerated folks, and ensuring that when folks transition back into their communities, they have a fair shot at working and thriving in our society. And what this current bill does is it creates more barriers for those folks where that's not necessary. But we can get there. As it relates to the push that I've been a part of, I know these conversations have been happening for a while, at least going all the way back to before Representative Snyder's time, going back to 2010. There's been referendums that have been pushed in counties since 2010, and it's gotten an overwhelming support of a lot of residents in those counties that have pushed it. So our bill, did similar in taking pieces from throughout states around the country and looking at both their medical and recreational boundaries and taking the best and adding a Wisconsin spin on it as well, so that we can do the right thing by all Wisconsinites and that we can create the revenue that we need to ensure that we all thrive, right? The projected revenue that we got in from the bill that we drafted was $165 million per year for full legalization, which means that over the span of the biennium, we're talking $330 million. As we think about all of the priorities that we're navigating in our state, as we think about the lack of funding for public education, as we think about the lack of funding for childcare in Wisconsin, as we think about the things that folks are navigating in terms of drug treatment programs, we can fund all of these things off the revenue we get from full legalization, and we can go even further to keep our communities safe if we regulate it, right? If we regulate it, because we know that the illegal market is here, right? We know it's everywhere, and we know that in the United States, right, we've seen over 110,000 folks, at least in 2022, overdose from laced products, right? Not specifically cannabis alone, but cannabis was a part of that conversation. So if we regulate and we ensure that folks are safe, consuming a safe product, we're applying a public safety framework to this issue. And then at the end of the day, as I think about again the equity framework, we intentionally push to ensure a reinvestment grant was a part of our bill so that the communities that were disproportionately impacted could participate in the industry and also benefit from its legalization.
Great. Well, thank you, Representative. Dr. Galbis-Reig, I want to pull you in here. Thank you for doing this. I guess first off, can you just share a little bit about your background and your practice and the type of patients that you treat and maybe what type of impact you see from marijuana amongst your patients?
Sure. So I am an addiction medicine specialist, and I work in southeastern Wisconsin, and I've been primarily doing a combination of inpatient and outpatient care. I'm the medical director of addiction services for a few organizations down here in southeast Wisconsin, and I'm here as a representative, to be clear, of the Wisconsin Medical Society and the Wisconsin Society of Addiction Medicine. But for the past 20 years, I've worked basically in the field of addiction, treating people who are suffering from that condition. And marijuana is one of those substances that I treat, marijuana or cannabis addiction, which is now called cannabis use disorder. We tend to diagnose it more often in adolescence. And that is one of the concerns is, and I know there's an age limit, but when you open the door for legalization in any way, what kids hear is, oh, it must be okay because adults say it's okay, and it can be used for medical reasons. And I think education around what cannabis is, what cannabis can and can't do, and side effects. And no one's talked about side effects, and this bill doesn't talk about side effects. Who's going to be responsible for adverse events and adverse side effects of cannabis from a dispensary? I mean, those are questions that this bill doesn't answer, and those are medical questions. And that's, I'm glad law enforcement was involved. I'm glad, but in the medical community, a physician from Minnesota who owns a dispensary has their own interest. That is not a physician from Wisconsin, and it's not a physician who has no interest in the cannabis industry. I have no interest. Most of my colleagues have no interest. We don't make money off of it. And the concern we have is that the efficacy for some of the conditions that are being touted in this bill, for example, glaucoma, has never been shown. And in fact, in some cases, it has made glaucoma worse. There are certain types of glaucoma cannabis can actually worsen. And there's a number of other conditions that are not necessarily proven. And PTSD, as much as I understand that people have benefited, and I get that. I mean, I have patients who tell me that it's the only thing that works, but there are side effects, and most of the side effects of cannabis are actually psychiatric side effects: depression, anxiety, psychosis, and suicide attempts. There was recent data that suggests that cannabis may be responsible for a significant amount of the increase in suicide attempts among adolescents. And that's something that we need to really think about, because cannabis has become more widespread. Cannabis is being utilized more, and we're talking about it as a potential medicine, which, by the way, as a physician, we take issue with that. In this country, medicines are approved by the FDA. That's what makes them a medicine. And I mean, and if we want to go there, the COVID pandemic really highlighted that, with certain certain medications that people were using. But the cannabis is not, it's an herbal. And as an herbal, like, any other herbal, it should be discussed in that manner, not as medicine. It is not FDA approved for any indication. There are cannabinoids that are, and we have them. I can prescribe dronabinol, which is THC. I can legally prescribe that right now. It's a Schedule 2 or Schedule 3, depending on the formulation. Nabiximols is another one, and Nabilone. So there are 3 cannabinoids that I can legally prescribe already in Wisconsin or anywhere else, because they're scheduled under the DEA differently. But they are not cannabis. Cannabis, when we talk about that, is an herbal. Herbals are classified differently. They're supplements, they're herbals. I mean, I recommend herbals sometimes. Milk thistle is great for liver toxicity. St. John's wort can help with mild depression. We use ashwagandha sometimes for certain individuals. I mean, there are herbals that physicians have recommended, but it's never a prescription because it's not a medicine. They're herbal products. And I think we need to be clear when we talk about it. These are therapeutic herbals. They're not medicines. They're not FDA approved. They have not gone through that rigorous process. And I think that's one of the concerns from the medical community. And the other concern is we don't want to be gatekeepers. I don't know a physician, unless they have a self-interest, that wants to be the gatekeeper for an herbal that they may or may not understand. In fact, there was data out of Canada, where it's been around for a long time, that demonstrated that when you ask physicians, can you explain the risks and benefits to a patient? Many of the physicians said, no, I can't, because I don't know enough about it. And part of being a physician is being able, when I recommend something, I need to understand the risks, the potential side effects, and the benefits. And I can tell you, we are not trained in that way. The majority of physicians will not be able to delineate that with cannabis, particularly different strains of cannabis. I mean, a high THC versus a low THC versus a THC CBD strain. I mean, they're not going to know the difference, and it makes it very difficult to counsel patients and provide education in that respect. So I think that, from a medical community standpoint, we're not politicians. We don't decide on what's legal or what's not. Our role is to provide the education on what can be safe and what cannot. And we have strong concerns about the current bill as it's written.
Thank you, Doctor. Could you see a situation in which the medical society could support any medical marijuana type bill?
And calling it medical? No.
So Representative Snyder, what do you think of Dr. Galbis-Reig's comments? I mean, so he's basically saying on behalf of the association that represents the state's doctors that they're against this. They're against the medical marijuana program. Does that give you pause you also kind of mentioned this isn't, how medicine is normally approved. Does that give you pause in going forward with something like this?
Well, the big hurdle right now is the federal government, the way they have it scheduled. I mean, cocaine isn't as extreme as marijuana. If they would deschedule it, we could start researching a lot better and get confirmation on some of the things that the doctor just mentioned. I do have concerns about psychosis. I do have concerns that both Illinois and Michigan have seen their DUI through marijuana go up by 20 to 25%. That is concerning. And the teen levels in Colorado. What effect does it have on the brain? We know alcohol because we've done the research on it. If we somehow the federal government makes it legal, we at least need to get all the information out like we do with alcohol and cigarettes and tobacco to make sure people can make informed decisions whether or not they want to do something like that. So I am concerned about that. Minnesota on their side for the medical side of marijuana had at most in their 8 or 9 years of doing this about 50 to 70,000 residents that were actually on this list. And when I hear testimony, and it's hard, I can see the doctor's point. It is an herbal type of situation, and calling it an herbal supplement might confuse this. I guess we're trying to name it something that people can not get confused about compared to the weight loss crap you see out there with all the herbal supplements. So I just think that when I have an ALS person that takes this and actually can get some relief, and this is them, I'm not hearing from the doctor, but get some relief and be able to do housework and do things like that, it's hard for me to overlook that. And someone that when we heard the CBD, and by the way, under 18, if they're having seizures or have terminal cancer, parental approval would allow them to be able to do this, so they would have some relief on that. This is, we recommend people see their physicians and do whatever they say to do to help them through some challenges. But to me, this is the kind of the end point of not getting some relief and just trying to get through the day. And that's why we're not making it widespread for the common cold or I get headaches once a week, or, oh, I'm a little depressed today. No, those things don't qualify like California had years ago, which led to you go into a dispensary and say, I'm feeling a little depressed. Oh, here, take this. This we want to make a little bit more accessible and a little more controlled. But again, we don't anticipate having millions of people in Wisconsin on this. It'll be more of a select group. But again, we don't want to overstep medical professionals. We do think, and that's why we have to have them at least confirm what the person is suffering from, rather than just a hearsay from the person like, I have cancer. Well, what's your provider actually say that your ailment is? So again, it's something that is tough. I mean, unless we have full research, like especially with the great professionals of the University of Wisconsin research, to be able to look into side effects, to look into some of the dangers of excessive. We see what happens when people drink daily and what it leads to. Well, what happens about people who smoke daily? And I've had law enforcement people tell me that recreational, it's a gateway to other heavier drugs, that they get like an immunity to it and they want to go farther along. That needs to be out there for people to digest. But I know in my county, in Marathon County, back in 2018, a referendum, I had over 80% in favor of the medicinal marijuana.
So just to follow up on that, as you mentioned, the Senate has issues with your current bill. It's likely not going to get through that chamber and get to the governor's desk. Where are, and you talked a little bit about this in the beginning, but maybe expound on this a little bit. Where are some areas that you think there could be compromise, and you think your caucus is open to making some of those changes to maybe get this to move forward?
Well, a lot of the members, at least in our caucus in the assembly, had some concerns about the state-run dispensaries, but they're kind of, pro competitive businesses and things of that nature. Some of the others had
Do
concern.
you see room for
to be
compromise
honest.
on that? Is that something changes that you think your caucus would be willing to make?
Well, we'd have to look, see how it's done. Again, I'm not going to say absolute no to anything because I think it's important to kind of reach out to the people that are need this. So I'm not coming out and saying absolutely no. But another big hurdle for a lot of our members, I would say this is probably more the reason why some of the Assembly caucus Republicans was law enforcement, and especially the sheriffs. They have real concerns with this. I think the chiefs of police were maybe thinking about being neutral. They're not, jumping up and down with pom-poms about it. But I think with the way we structured it, they might have been neutral. But the sheriffs were still really concerned. So that would be something, if this doesn't get through this time, that we try to work with a little bit more and maybe reach out more to the medical community to see if there's something we can do. Because like the doctor said, there is some THC that is prescribed, but some of the people I talked with said that doesn't work for them. I don't know. Again, I haven't had any of these situations in my own family, so I have to rely on folks that have been affected or are being affected. And so if it doesn't make it through this time, I do think we just don't ignore it, but try to reach out a little bit more. Maybe bring not only what we worked with Ledge Council and look at other states, but reach out to our medical society friends as well as law enforcement to see if there is some kind of a compromise that we could help with these situations and disagreements.
So the other side of this is, for the most part, the majority right now, the majority of people in Wisconsin, if they want marijuana, they can get it. They can drive to Illinois, they can drive to Michigan, they can soon drive to Minnesota. They can go to Willie Street here in Madison and buy some hemp-derived version of this or one of the Delta products. It's out there. People are getting it. Why not just make it safer and regulate it? Why not move forward with full legalization of this? Wouldn't that be a safer environment?
Well, I might be a lot more open to it if we would actually get it descheduled and get some research to know what's happened. I had a former sheriff of mine say, we've done such a great job with alcohol. Yeah, let's make marijuana legal. We've had problems with it, but we talk about the legalization and the funds that would come from this, and there would be plenty. And there are people going over to, I heard cheaper in Michigan than Illinois. I don't know about anything about Minnesota yet. But in any case, yeah, they're spending money there and they're bringing it in and they're not being stopped at the border or anything like that. And a lot of the DAs are just if you're caught, you're getting ticketed, a fine, like possibly an, open container inside your vehicle. So, yeah, I can see that being, an issue. Let's just make it legal everywhere. But again, I just think that we need a little bit more answers on some of the things. What does smoking daily or smoking once a week do to a pregnant woman? What does it do to the development of the baby? I mean, there are so many things I would like answers to before I give it a green light to be able to be proceeded through. So those are my concerns. And I know the people in the state of Wisconsin are kind of favoring this. But again, you got to look at some of the things that have happened in Colorado and some of the other states on the other side. And, some of the money that Representative Madison brought up, of the millions of dollars that should be going into some kind of health for some of the people that have bad effects on this or addiction problems down the road.
Dr. Galbis-Reig, you wanted to add to that?
Yeah, I wanted to let Representative Snyder know there is actually very good data already on what happens in pregnant women. We already have data on that. It increases the risk of preeclampsia, increases the risk of premature birth, it increases the risk of low infant birth mortality, and it has infant effects. So we actually have very good data on what cannabis does in pregnancy. There's actually articles that have been recently published. Because of the social experiments in other states, we actually have pretty good data on cannabis side effects, believe it or not. We know it increases the risk for heart attacks and strokes. That was a recently published article by the American Heart Association. It decreases life expectancy by 10 years if you use it regularly and on a daily basis. So cannabis is the next tobacco. I mean, And the cannabis industry has known this. I mean, just like the tobacco industry manipulated nicotine levels, the cannabis industry has done the same with THC levels. I mean, if you look at natural cannabis, the cannabis that most of our grandparents would have known, it was 2 to 4% THC, 1 to 2% CBD. That is not what's available now. The average strain has 10 to 15% THC and no CBD. And there are strains that have up to 30% THC. It has been inbred to create a much more potent THC-rich plant by the industry because they know what keeps people coming back. And that's, I mean, you can regulate that, but people are going to get what they want to get. I mean, they can get it from other states or everywhere else. The illegal market's always going to be there, just like it was with alcohol. I mean, I grew up in Virginia where the state does own the ABC stores. In Virginia, the ABC stores are owned by the state. So what did people do? Guess what was big in Virginia? Moonshine.
Yeah.
You don't see moonshine that much in Wisconsin. You see it in Virginia because you had to go to the ABC store to buy liquor and they would limit how much you could get. So, I mean, no matter what the regulatory framework is, people will get the product they want. I mean, we can regulate it as best as we can. Our concern is calling it medical is confusing. I mean, you said you don't want to call it medical, but to me, that is confusing because we just said medicines are FDA approved. We say that all through COVID, all the news media would tell you, well, it's not approved for that. If it's an FDA approved medication, the populace knows it has been rigorously studied. Now we can argue all about FDA approval and all that. We can have discussions about that. But the bottom line is it goes through some process. Cannabis hasn't gone through, as an herbal, hasn't gone through any of those processes. And to call it medicine is confusing. It is not a medicine, it's an herbal plant. It may have medicinal properties and it may have therapeutic properties for some people, and I'm not discounting that. I have patients who swear by it for certain conditions. And I don't tell them they're wrong because they get better. I mean, whether it's placebo or not, it doesn't matter if they feel better. And they're not having consequences, and that's the key. There are side effects to this, and some patients have significant side effects and they refuse to see them. One of the biggest ones that we see a lot in the emergency room is this cannabis hyperemesis syndrome, where they come in with this vomiting all the time. And we've seen more and more of that. And psychosis is a big one. We do see that, especially in young people using, especially the synthetics, the K2 and spice, which we still see out there. So I think we need to recognize that what the terminology we use is confusing. It isn't a tried and true medicine at this point. Yes, there's some data that we need to do more data, and I agree with you. I think part of the problem is that it is scheduled the way it is, and we can't study it as well. But there are studies being done, and they continue to be done, and new research is coming out all the time on the potential benefits and side effects. And we just have to let that play out. Before we call it medicine, is what I'm saying. If you want to legalize it any other way, I don't have skin in the game in that. And I think, as physicians, we may have opinions, personal opinions, and I have my own personal opinions. But I, as a society, we probably wouldn't get as involved. The problem is you're calling it medicine.
So, Dr. Galbis-Reig, what if it was legalized recreationally here in Wisconsin, like it is in a number of states? It's something that polls say voters want, Republican and Democrat voters want. Here, what would be the health impact of that? I mean, you're an addiction specialist.
Correct.
Do you have any concern about that? About this being
full-blown
legalized?
about recreational legalization? Of course, I have concerns about it, but at least in that, now I'm not going to speak as the Wisconsin Medical Society representative. I'm speaking for myself right now, just to be clear. From a personal perspective, full-blown recreational legalization at least isn't confusing. You're saying I'm legalizing something that we know is psychoactive, but we're not going to call it medicine. And yes, we know there are side effects and consequences, and it's going to create some societal problems. But at least let's educate people about the bad risks and benefits. Come on, tobacco kills 500,000 people a year. It's legal. It kills more people than any other drug out there. Alcohol kills more people than heroin. People don't talk about that. And then you've got, so we've got legal substances that already have significant problems associated with them. what we have to do a better job at is our public health infrastructure and education, and giving people the information that they need to make their own informed decision on whether they want to use it or not. I can tell you the people that get in most trouble with cannabis are the regular, daily, habitual, high dose, high potency users. The people that are using the really strong stuff. Some of them, it'll be the high, the 100% THC vape cartridges, the wax and the crack, all these, they have all these names for these, crackle and brittle and all this stuff. And I mean, those are the stuff that get people in trouble. That's 100% THC. And yeah, we can regulate that, but there's going to be a market for it. And so with legalization, at least I'm not the middleman. My colleagues aren't the middlemen. We have to deal with the consequences. Will there be consequences? Absolutely. Our OWI laws would need to change. Our OWI laws in Wisconsin are some of the least restrictive of any state. And one of the problems is, and there's a study, a very good study with this, if you combine THC and alcohol, any level of alcohol becomes toxic, even if you have tolerance to THC, because they work synergistically in two different ways to impair you. And cannabis is impairing for driving. There's very good data on that. I mean, we know that. It's different than alcohol, and there's no roadside test at this point. So we would have to change the laws and the rules to take into account that potential societal risk. Because if I don't smoke cannabis, I don't want Joe Schmo down the road who may be using it for their own reasons to kill me by accident because they're driving while they're using cannabis. And I don't think most people want that. And so I think, that is where involving the medical community in when you make these legislations, I think is important. And I think, I'm not saying that, I'm not personally, I'm not opposed. Like I said, I'm not, whether it's legal or not, that's not my decision. But my job and my duty is to make sure that when we're talking about this, people are thinking about the risks, the benefits to individuals and to society from a health standpoint. And there would be health risks no matter how it's legalized. Some of those can be mitigated, but they can't completely be taken away. I mean, and we know that from other states that have already done it. So let's learn from that, and let's put guideposts in place to try to prevent these things from happening instead of just opening in the Pandora's box, as was said earlier. I think there are ways to do it correctly or better. There is no correct, I don't think, but better, in ways that can make it a little bit less clear.
Thank you. Representative Madison, you've focused a lot of your efforts on full legalization for adult use and for a medical program. There's bipartisan legislation that's been unveiled to decriminalize small amounts of marijuana. In the meantime, do you see that as a good path forward? Milwaukee already does it. A growing number of cities already are decriminalizing marijuana. I guess, what are your thoughts on that and the impact that could have?
Yeah, so for sure, I think that yeah, you're right. Milwaukee's already been there, right? We've done the dollar fee in Milwaukee County. Dane County's also done the dollar fee as well. It hasn't necessarily changed how our how folks are criminalized in our counties. I think that the bill that former Senator Taylor and Shea Sortwell and other folks have been working on has some good pieces. And I haven't fully looked at all the moving pieces of that bill, but it's a good start. I think it moves us in a good direction as we talk about educating, ensuring that folks aren't disproportionately impacted by the criminalization of cannabis, and our communities having deeper conversations about what needs to be done to ensure that folks have, one, access to a substance that again is regulated. Two, folks are educated about the medical concerns as Dr. David also uplifted. But those are conversations that we need to continue to have. And at the end of the day, overarchingly, The problem that we're dealing with is folks don't have access to adequate medical care in this state and in this country, right? We know that's our reality, and we know that, you know, folks turn to you know, to different forms of treatment as a repercussion of that. And cannabis is a tool to help folks who need it, whether that's a placebo effect or not. I think those are the conversations that folks should be able to have with their physicians and in their families and in their communities, especially as we think about, you know, folks dealing with chronic pain, anxiety, all of these conditions. But we get there through full recreation. You know, giving folks access to recreational use of cannabis, because what that does is that gives us the access point to the resources that we need to fund the education that folks need to make an informed decision, and to get our society having the conversation more, because we're not having it enough. And like, you know, Representative Snyder said, we've dealt with these same things as it relates to other things, whether it's been tobacco, whether it's been alcohol, right? We had the prohibition of alcohol way before any of us were born. We had those conversations as a you know, as communities and as states and as legislators, and we made a choice. We regulated it. We gave folks access to it. And we continue to reassess what we need to do to ensure that our communities are safe. And we author new legislation to make sure that happens. But we can't do that unless we're moving in the right direction. And that can only come if we're taking both steps. And that's my thoughts.
Excellent. Thank you.
Can I make one point about
Yes,
what he
yes.
said? What Representative Madison said about decriminalization is key. We, as a medical society, we are absolute advocates of decriminalization of substances. I mean, because when you criminalize someone for their disease, especially if they have addiction, our criminal justice system is not geared toward treatment. That is not their role. That is not why they were created. And when you criminalize addiction, they don't get the treatment they need. And this is why release of these individuals, once they're released from jail or prison, their risk of death is much higher because they go straight back because they never had the treatment and they don't have the resources. So I think decriminalization is a different point. That's not what this is about, but I think that's an important discussion above and beyond whether this bill makes it through or not, is can we get a decriminalization bill through? I think that would be another point of discussion.
And just a quick follow-up, Representative Snyder, on that. I mean, is that something that you think could get through? It has bipartisan support, including from your caucus. Is there, you know, an appetite for that to get forward?
Yeah, I think there's an appetite for that. And the doctor's right. It is an addiction, and we need to treat it that way. Unfortunately, when it comes to alcohol and some of the others, unfortunately, there's death also, taking innocent lives. But I think the one thing that we are, as the doctor said, dropping the ball on is that they aren't getting the treatment while they're filling their sentence. That's why one thing about, I hope Lincoln Hills, that's going to be closing soon, I'd love to see that become a treatment center for those that have violated like 5th or 6th offense OWI, to be able to go there, serve their 18 months or whatever the case might be, but get treatment at the same time and try to help them. Because the doctor's right. If they're addicted to drugs, they might be taking so much oxy when they go in, and then when they get out, they think they can still take that same amount and they OD. So education's necessary and things to that nature. But when it comes to marijuana, yeah, decriminalization. And I think at least my district attorney has made it more of a monetary ticket than anything else. People in Marathon County Jail right now aren't in there for marijuana only. It's for other violations.
And if
Excellent.
I can jump back in,
Yeah.
I think that we, you know, especially as we look at, you know, our carceral state, and what's happening in the Department of Corrections, I think there's been a lot of efforts bipartisanly to address the needs of folks who are incarcerated. and ensuring that folks have access to the treatment programs that they need, right? I think that, some of the pushes for adequate pay for, for our correctional officers feeds into that, because again, a lot of folks have been sitting in their cells for more than 8 months now, without adequate programming, because our a lot of our facilities have been understaffed, and that's why there was that push for that raise. But I think we also need to have a conversation about non-uniform staff in our correctional facilities. You have folks who run treatment programs in our facilities that don't get adequate pay compared to their colleagues not in a correctional facility. What does that mean for folks who who need these treatment programs? Is that they're not getting access to their care, right? We can pay for the correctional officers to be able to give folks access to these spaces. But if we don't have the staff to run these programs, even the dream that Representative Snyder is uplifting with Lincoln Hills is not obtainable. So, I mean, there's been an effort, especially in my office, to look at how we can improve conditions of confinement for folks who are incarcerated. So when folks come out, they have what they need, including being connected with a physician, a primary care physician, and the other supportive resources that they need to thrive. But that's a continuum, right? That's not a one bill fix all solution to this problem. But we've been trying to work on it to ensure that folks, we're improving society, we're improving public safety, and we are ensuring that folks are able to reintegrate into a society where they have the opportunity to thrive.
Thank you. Thank you, Representative. I think you all were quickly running out of time. I want to just take one final question, maybe just a minute total between everyone to answer this final question, just to kind of wrap things up. What do you think in 3 years from now? What is going to be the status of marijuana in Wisconsin? I want you to all take your crystal ball. I know panelists hate doing this, but it's interesting. I think the audience, you're experts in this. The audience appreciate this perspective. Dr. Galbis-Reig, we'll start with you and kind of work our way down. 3 years from now, what is going to be the status of marijuana in Wisconsin?
I think a lot's going to depend on the federal government stance, but I suspect that the federal government is going to reschedule it. I don't think they're going to completely unschedule it, but I think it's going to be rescheduled, which is going to change the landscape of marijuana across the country. I don't know what that means from a legalization standpoint completely, but I do suspect that there'll be some form of legalization by that point in Wisconsin.
Thank you. Representative Madison, what do you think? What is going to be the status of marijuana in Wisconsin 3 years from now?
Yeah, me rubbing the crystal ball, it's fully legal. I think that, if we're paying attention to what we've learned from other states, many states have went the medical route, but they always end up at recreation, because they understand that the benefits outweigh the problems, especially when we can inform the broader public about the issue. We can create the systems that our society needs, if we're willing to come to the table and do the work. And that's what me and Representative Snyder are trying to do. And as long as we apply an equity framework to everything that we do, I'm down.
Thank you. Representative Snyder, we'll give you the last word.
I guess I agree with the doctor that if it is rescheduled and the government relaxes things, especially when it comes to banking, if suddenly people that make money on this can actually put it into banks without federal rules and legislation, that'll make it tough for states not to feel the pressure of that. But it also depends on, in 3 years, that'll be either the same party in power as a governor or another one. If it is the same party and things change with the majority, then I would say it would probably be legal in the state.
Well, thank you. Thank you all. This has been a really great conversation. Really appreciate you all taking some of your valuable time to do this. Thank you all to our sponsors for making this possible. We'll be back in person for our next event on February 13th. newsmaker event with Secretary Designee Kirsten Johnson. We hope to see you all there. Thank you all.
Thank you.
Thank you.
Have a good day, everyone.